Thank you. Today our guest is Dr. Vaidehi Kumari Gupta, MD Homeopathy. She is the Assistant Professor, Department of Practice of Medicine, Dr. R.B. Singh, Gaya Homeopathy Medical College and Hospital, both Gaya, Bihar. And the topic is facial features of PSORA. We all know that the relevance of this miasm PSORA, because Hahnemann invented when a situation arises that their beginning was promising, continuation less favorable, and outcome hopeless. That was the situation Hahnemann faced. So he developed the PSORA theory and he defined beautifully the most ancient, the most destructive, yet the most misapprehended chronic miasm. Is a wonderful definition is there. You can see in the chronic disease textbooks. So on behalf of IFPH, I am welcome Dr. Vaidehi. You can have the platform for the next 45 minutes. It's over to you. Please proceed.
Thank you, sir. Thank you for such a kind words. And thank you, IFPH, for giving me such a wonderful platform. I'm just sharing my screen.
Yes, you can, as a co-host, please.
Is my screen visible?
Yes, yeah. Of course.
Okay. So the topic is facial features of PSORA. Introduction. You cannot judge a book by its cover. It is a very popular saying, but it's not true always, because especially in homeopathy, we can judge a person by the way he look, by the way he talk, or the way he walk. So everything is important. So when we say that we can't judge a person by the way he look is not entirely accurate. Yes, we can. Like facial structure can determine with reliability their dominant masm. Because when we calculate, like these are like points. Like when we tell someone about the type of eyes, the type of ear, then we are just calculating them, and we can determine which one is the dominant masm. Like hairline. Talking about hairline, the example is widow's peak. The widow's peak is where the fringe of the hairline creates a downward triangular peak with sharp point. It looks like a triangle where the base is in upside and the apex is in downward. There is a fringe of hair which looks like this inverted triangle. So this is widow's peak. The shaded area is that inverted triangle. There is a pointed fringe in the middle portion, while in the rest of the portion, there is no hair. This is called widow's peak. This is the original picture of widow's peak. The dotted line indicates the margin of the hairline. Now, what is the literal meaning of widow's peak? Looks like a peak of a widow's hood, like a headdress. It was actually worn by women who are widow. So it looks like a triangular, inverted triangular area, particularly the distinctly hood with a pointed piece in front, which widows wore as a hood of the mourning. That's why it is named as widow's peak. Next one is M shape. The M shape hairline is where the fringe of the hairline may be rounded to form an M. So the hairline will be in the shape of M. It will be not that much pointed like M, but it looks quite similar to letter M. So this is M-shaped hairline. We can see by this dotted line that it looks like a letter M. Now forehead. The forehead will be sloped. Sloped is very prominent in PSORA masm. The forehead will be sloped. The eyes will be slightly sloped. The ear will be sloped. Chin will be sloped. So sloped feature is quite prominent in PSORA masm. So what is the criteria of that sloped forehead? When with the vertical line, when the forehead makes an angle of 12 degree or more than 12 degree, it will be considered as sloped forehead. These are pictures of sloped forehead where the angle will be more than 12 degree or 12 degree. This is the original picture of sloped forehead. We can see in second figure, there is a dotted line that indicates that incline. It is slightly slant. Now eyes. Eyes will be downturned eyes slope downward at a more pronounced angle than the first half of the upper eyelid. So in figure, we can see that on the top figure, it's quite normal, but in the lower picture, it's slightly depressed in the lateral portion and slightly angulated. So the medial canthus will be slight superior portion and the lateral canthus will be appear like slightly downward phase. So medial canthus will be raised slightly and lateral canthus will be slightly depressed, slightly low to the normal level. So these are downturned eyes. These are also examples of downturned eyes where the lateral canthus is slightly below in comparison to the middle one. This is the original picture of downturned eyes. Now closed set eyes. When the inner canthus of each eye appear close to the bridge of the nose than average. So in the upper figure, it's quite normal. It is in the midline. While when we tell about closed set eyes, they would be quite closer to each other. They are quite close to the bridge of nose. They are quite close to each other. That's why they are named as closed set eyes. It is also present in soramasm. This is a picture with an example of closed set eyes. These are also some examples of closed set eyes where the eyes look quite closer to each other in comparison to other facial features. Now small eyes. It is a visual interpretation in context with other facial features. Like in these pictures, the eyes are quite small in comparison to other facial features. The forehead is quite broad, the nose is quite broad, lips are full, chin is quite long, but in comparison to all these features, the eyes look slightly smaller. So these are small eyes. This is the original picture of a small eyes. Now small and downturned eyes. Then when we tell about small eyes, it will get 1 point. When we say small and downturned eyes, it will get 2 points. First, small eyes, it is also prominent in soramasm, and downturned eyes, it is also present in soramasm. So it is small and the lateral canthus is slightly below in comparison to medial canthus. So this type of faces will get 2 points for sora. Full lids. Full lids extend over the eyeball, covering an area of 30% or more than 30%. So when the lids will cover the eyes, and when this coverage is more than 30% or equal to 30%, it will be considered as full lids. It will be considered as sora. So this is a picture of full lids. Here, full lids with downturned eyes. So this face will get 2 points. 1 point for full lids, which is present in sora. Also, the lateral canthus is slightly below in comparison to medial canthus. So it is a downturned eyes. So overall, this face will get 2 points for soramasm. Full lids and small eyes. It will also get 2 points because majority portion of the eyes is covered by the lid, which is more than 30%, and the eyes are small, so it is also a feature of sora. Now nose. When we divide nose in 3 hypothetical portion, upper portion, middle one third, and lower 1/3, generally there is a bump on nose, and it is more prominent in the upper portion, generally located in the upper third of the length of the nose. In some cases, it will be in the lower third. It may be in upper third, it may be in lower third, it may be in middle third, but the upper portion is quite common. A bump with further down the nose will give an overall curved or hawkish appearance. And when this bump is at the end of the nose, it will give a feature of slightly down of the nose, and that's why it look like a hawk, like a beak of hawk. So it will give us a hawkish appearance. Nose bump in upper third In both of the picture, there is a nose bump, and nose bump is in the upper third of the nose. Nose bump in lower third of the nose, we can quite clearly see that the nose bump is present, and it is present in the lower third of the nose. Downward or curved nose. Tip of the nose is lower than the junction of the nose to the face. Means the point where the nose is attached to the face, the tip will be more lower to that junction. A definite downward curve, that is called hooked nose or hawkish appearance. So it will look like a beak of a hawk or like a hook. That's why it is called a hook nose, hawkish appearance, or downward or curved nose. So these are downward nose. It will be slightly lower in comparison to normal one, and it is slightly lower at the junction where the nose and the face combine. Curved nose, the nose will be not straight, it will be slightly curved. It is also a feature of PSORA. Downturn with a bump. Here this face will get 2 points, one for downturn and other with a bump. In the lower portion, it is hawkish. That's why it is called downturn. And there's also a bump. That's why it will get 2 points. Mouth. Small mouth. When the mouth will be slightly small, like when eyes look small, it's PSORA. So when mouth looks small in comparison to other facial feature, it is also considered as PSORA. So if hypothetical lines are drawn downward in a straight line from the wings of the nose to the mouth, a small mouth lies inside these lines. So when we draw a hypothetical line from the wings of the nose, and it will be quite smaller, that's why they will come inside those lines. Small mouth showing hypothetical lines. So first one is just a figure, and in second figure, we can see those lines. These are hypothetical line, and the mouth lies between these two lines. Small mouth. So also again small mouth. Now lips. It is a visual impression, but there may be some problem, like lipstick can be a problem. With the help of lipstick, the lips may look thin. So it will be slight confusing when the patient applies lipstick and then they come to the clinic. Also, smiling pulls the lips, making them look thin. So when during smiling, the lips will stretch and it looks thin. So we have to take care that there is not the lipstick is not applied, and also they are not smiling. It will be in a normal face, like a poker face. Then we can conclude quite clearly where there is no expression. So thin lips, these are examples of thin lips. This is the original picture of thin lips. Small mouth and thin lips. The mouth is small as well as the lips are thin. So this will be considered as 2 points. Smile. Compact smile. The dental arch is smaller and more compact. Compact means they are quite close to each other. Then there will be some space left and it can be seen visually. So there is a space between the teeth and inside of the mouth. This is an example of compact smile. The red shaded area is the space which can be seen easily, and it is an example of compact smile because the arch is quite close, quite small. Teeth. Two front teeth. When the two front teeth look more prominent, large, or forward than the teeth beside them. So in the entire row, there will be two front teeth that will look different in comparison to the other one. This can give a rabbit or bucky appearance. So it will look like a rabbit, or that's why it is also called rabbit teeth or bucky teeth. It looks like teeth of rabbits. Prominent front teeth longer. In this picture, all the teeth are aligned in the same row, but front two teeth are slightly longer in comparison to other one. So it will be considered as soramazum. The two front teeth are considerably longer than the other teeth. This is an original picture where everything is fine, but the front one is slightly broader and slightly longer. Another example is the two front teeth stand out from the other teeth. All the teeth are aligned in the same line, but here these two teeth are, although they are slightly broad, long, they are also slightly slightly inclined, so they look quite different. They are outstand from other one. So when the two prominent teeth are different from the entire row, it will be considered as SORA. Chin. So sloping chin, like sloping forehead, there is also sloping chin. The chin lies back from the mouth, hypothetical line vertically either from between the eyes or upper lip. So here we can draw a line either between the eyes or from the upper lip, and we can see that the chin is slightly back in comparison to the whole features. The sloping chin sits back from the point. Comparing these two pictures, first one is normal. These are all aligned in the same line, like the lower lip and the chin. It is in the same line. While in the second one, where there is sloping chin, a hypothetical line from between the eyes, we can see that it doesn't cross the line. The chin is not in this line. It's slightly back from the normal. Then it is called sloping chin. It's also an example of sloping chin. Hypothetical line vertically from upper lip. So as I said earlier, we can decide it either by drawing that line from the eyes or from the upper lip. So here the hypothetical line is from upper lip, and we can see that the chin is quite in backward line in comparison to that one. So it is also example of sloping chin. Sloping chin without any defined bone structure. When the chin almost merged to the neck, then it is also called chinless, where we can't see whether the chin is present or not, because it is that much sloping, it is that much backward that it almost merged to the neck. That's why it's called chinless. Ears. Ears high. There are two conditions for SORA. If the eyes are higher than the normal level, it is SORA. When they are lower than the normal level, it is also considered as SORA. So a hypothetical line from the bridge of the nose horizontally towards the back of the head, the top of the ear is visibly higher than this mark. So when the ear is slightly higher to this line, like when joining the nose, bridge of the nose and the back of the head, the ear will be slightly higher than these lines. Then it will be considered as high ears. The first figure is normal one, where a slight portion of ear is above the root of the nose, while in the second figure, which is ear high, majority of portion is above that line. So it will be considered as ears high, and it is SORA. This is also an example of ears high. Now ears low. A hypothetical line from the bridge of the nose horizontally towards the back of the head. The criteria is same. The top of the ear is visibly lower than this line. So when the upper region of the ear is quite lower than this line, it is also considered as SORA, and it is ears low. So ears low, we can see that the ear is very much low in comparison to that hypothetical line. So when it is high, it is also SORA. When it is low, it is also SORA. When it is not in normal position. This is an example of low ears. Ears are quite low. Ears sloped, like sloped forehead, sloped chin. Ear is also sloped. A hypothetical line from inner edge of the lower lobe of the ear to inner edge of the upper part of ear should rest just behind this line. So in the diagram, there is a vertical line, and another line joining the upper inner edge and lower inner edge, when it will make a degree of 20 degree or more than 20 degree, it is considered as sloped ear, and it is a sign of psoriasis. So these are examples of sloped ears. The ears are quite inclined and the degree will be more than 20 degree. Sloped and high. Here this will get 2 points. First point for the sloped ear, because it is inclined more than 20 degree, and it is also high. The line which is from the root of the nose, from the base of the nose, the ear is quite higher to that line. So it will be sloped and high. Sloped and low. In this figure, the ear is sloped as well as it is low. Lines. Forehead lines. Either across the forehead or in the middle, just above the ear, there will be multiple of lines. Most people, when they frown or look surprised, have a strong and eye-catching lines in their forehead. So when they show their expressions, when they are frowning, when they are angry, when they look surprised, the lines are quite prominent. They are eye-catching line. They may be straight or wave-like, and both are considered in PSORA. These are also called worry lines. Multiple lines in the middle of the forehead. So when there are multiple lines in the middle and they are quite straight, it is PSORA. Multiple lines across forehead in a wave shape, and when it will be in wave pattern, it will also considered as PSORA. Normal lines near eyes. Most adults will have these lines at the corner of eyes, especially when they smile. So when a person smiles, there will be some lines near the eyes, and they are also called crow's feet. So these lines will look like a feet of crow. That's why they are called crow's feet. Crow's feet. In the second figure, the line is shaded and it quite look like the feet of crow. That's why it is called crow's feet. Both pictures are same. The lines are just shaded. Lines extending directly downward from the eyes. So when these lines will extend directly downward, almost perpendicular, it is also considered as PSORA. Lines below eyes slant slightly at an angle away from the lower lid of the eyes. In this picture, there are lines, they are from eye, but they are not directly below. They are not almost perpendicular. They are inclined, they are slant, and that slant sloping is quite common in PSORA. Lines extending to cheeks. If very deep, these lines may extend to the cheeks. This generally occurs only when smiling. So when smiling, these lines of eyes merge with the cheek. Then when they extend to that extension, it is also PSORA. Two or three lines between eyes. They are judged by their depth and are often seen during the consultation, that there will be lines between the two eyes. Two lines extending from the eyebrows. We can see the lines near the eyebrows. There are two lines and they are extending exactly from the eyebrow. This is PSORA. Two lines from between the eyebrows. In the earlier one, they were arising just from the eyebrows, but in this one, they are arising between the eyebrows. It is also PSORA. Two lines diagonally inward. When these lines are diagonally and in inward region, it is also PSORA. Two lines unequal length. When they are not of almost same length, earlier they were of about almost same length. When they are unequal, this is also PSORA. Multiple fine lines, either all over the face or on the cheek. So when there are multiple fine lines on the face or over the cheek, it is PSORA. Multiple fine lines especially in the cheeks. Skin. Freckles. Freckles is quite common in PSORA. So yellow skin features numerous and cover most of the surface area of the face and easily noticeable. We can easily notice it. Freckles is quite common in PSORA and they are numerous. They cover on most of the surface area of the face and they are yellowish in color. So these are freckles of the face. Complete face study. This is a picture of a boy, and the features that concern they are related to PSORA are just indicated. I just had the other one, which were from other MASM. So when the eyes are downturned, this is symptom of PSORA. Freckles, which is not that much visible in the photo, but freckles are present, which is also PSORA. So we can calculate it but just by counting the points, like how many features are related to PSORA, how many features are related to syphilis or psychosis or others, and then we can find which one is the dominant MASM. Front is prominent. Two front teeth will be prominent, and they will be different from the rest of the teeth. They outstand from the other one. It is PSORA. So two teeth, these are prominent, and it is sign of PSORA. Forehead sloped. Sloping is quite common in PSORA. Sloped cheek, sloped chin, sloped forehead, sloped eye, sloped ear. So sloped forehead is PSORA. Eye high. So when the imaginary line is crossed through the root of the nose, the ear will be in higher position to that level. So the ears are high. The chin is sloped. We can see that the chin is quite backward in comparison to the upper lip or in comparison to the eye. So when we draw a hypothetical line from the lip, we can see that chin is quite backward to side. So it is a sloped chin. Overall features. Hairline, widow's peak. Widow's peak means inverted triangle. The base will be in upward direction and the apex will be in lower direction. Means it is an inverted triangle. That hairline is called widow's peak. Widow word comes from the word that widows used to wear a headdress for the purpose of mourning. That's why it was called widow's peak. M shape hairline is also from PSORA. It will be not that much prominent to M shape, but they are slightly curved and quite look similar to M shape. So M shape hairline is also from PSORA. Forehead as a sloping. So it will be sloped when the degree will be 12 degree, or when it will be greater than 12 degree, the forehead will consider as sloped forehead. Eyes, downturned eyes, when the inner canthus will be slightly upward side and the outer canthus, the lateral one, will be slightly off lower side, then it will be considered as downturned eyes. Close set eyes, when the eyes look quite close to each other, it is called close set eyes. The eyes will look quite close. They will look quite close to each other and also to the bridge of the nose. So these are close set eyes. Small eyes, when the eyes will look small in comparison to other facial feature, like in comparison to forehead, in comparison to nose, in comparison to the lips, the eyes will be small, then they are considered as small eyes. Full lids, when 30% or the more than 30% of eyes is covered by the lids, these are considered full lids, and it is also a sign of PSORA. Nose, when there will be bump on the nose, it will be considered as PSORA. The bump may be in upper third or the lower third. The upper third is more common, and downturned, when the tip of the nose will be more downward in comparison to the normal one, it is called downturned nose, hawk appearance nose, or hook like nose. Curved nose, when the bridge will be not that much straight, it will be curved, then it is called curved nose. Mouth, when we draw a hypothetical line between the wings of the nose and the mouth will lie within those lines, it is considered a small mouth. So, it's like a small ear, there is also a small mouth. Lips, thin lips is considered as sora, and but we have to keep in mind that the patient is not applied any sort of lipstick, or they are not smiling, because of a smiling the lips may stretch and it will appear like a thin lip. So it will be normal face like expressionless or poker face, then we can judge easily whether it's actually thin lips or not. Smile, compact smile, when the denture of the teeth they are quite close to each other, and we can see space mm, around the teeth, it is considered as compact smile, and it is also a feature of sora. Teeth, front two teeth prominent, they may be either large in size, or they when they outstand from other teeth, it is called then the teeth will be called prominent. And it also look like rabbit teeth, it is also called bucky teeth, because it looks like the teeth of rabbit. Chin, like sloped eyes, ear, the chin is also sloped. And we can consider it by drawing a hypothetical line from either from the eyes or from the upper lip, and when it falls quite backward in comparison to these features, it is considered slope cheek. And when it almost merged to the neck and there is no any sort of prominence, any bony prominence, the feature is called chinless face, and it is also a feature of sora. Ear, when we draw a line from the root of the nose and the ear lies higher to that, it is high ears. When it lies quite lower to that line, it is low ears. And when they are sloped and makes an angle, it is all these features are of sora. Lines, when there are multiple lines between the forehead, they may be straight, they may be wavy, and they used to multiple, especially when they are frowning, they are angry, when they are surprised. So we can easily notice it. Below ear, below eyes, we can see just below the eyes, they can be straight, they can be inclined or sloped. Two or three lines near the eyes or the crow's feet, which are also called worry lines. All these lines are prominent. Then this is sora. Between the cheeks, when these lines merge to each other, like those lines of eyes and lines of cheeks, they merge and just make single line. It is also sora. When there is multiple of fine lines, this is also sora. In the skin, when the freckles are present, they will be in yellow in color. They are multiple in color. All these features are of sora. Reference, Grant Mentley. This webinar was exclusively collected all the contents from the book of Homeopathic Facial Analysis, which is a Vision publications of 2022. Thank you. I think it just ended quite early in comparison to other one.
Yes, nice presentation, doctor, because it once again makes it clear that homeopathy is not an easy subject to study. A lot of reflection is needed. A lot of capability of observation is needed. Because we know that from the history of homeopathy or Hahnemann, his father trained him to think something always. So when a patient comes, it's the duty of the physician to make a good reflection of total to the patient. Moreover, what is more important here is that we will get a clear picture if you have a good idea on that. Because when you know that during the case taking, the patient is hypochondriac. Naturally, they will often express their symptoms in different ways. But when you are very familiar with these objective symptoms, objective signs rather, definitely you will succeed. That's the most important thing. The time for discussion. Those who would like to participate, please raise your hand. Because the participation indicates that how much of you are in or interested or you are listened this program. That is also very important. But unfortunately, during these Zoom sessions, we will not get a real reflection from your face. As you just mentioned about this, the frown face, just like a podium. You can see our foreign minister often talking with a frown face. So Jaishankar is always. So when you see a patient, the doctor should. Well, I am watching in your face whether I could get something from your face. That's Dr. Vaidehi. How will you describe the small mouth is the large nose? That's so very important. And in the coming days, definitely that will force us to think on that way also. That's very important, very interesting one. So it is up to the duty of the honorable participant to make some comments or observations. That is very much important, and what we are waiting for that. You just mentioned about 12 points. Am I right, Doctor Videhi?
Sorry, sir.
You just mentioned about 12 points. One is the hairline, the first one is. You said about the M-shaped hairline, then the widow's hairline. These are very important thing. Without any alteration or you can observe the patient's face. Then another you said about this forehead, how the forehead is sloped or not. So it is always it is needed to watch the patient sideways. If you watch him straight, you will not get. So that's also very important thing. From the side view also is needed for getting this forehead. Then regarding the eyes, you said about this downward eyes, close set eyes, small eyes, then footlids. That if you could able to connect certain medicines to these aspects, then that will be more interesting. What is your opinion, Doctor Vaidehi?
Okay, sir. In future or right now?
Yes. Could you please give some examples? You are doing that.
By when I discuss about the features, like
Vaidehi,
am I audible? Sir, am I audible?
yes, Dr. Vaidehi,
Yes, sir.
am I audible?
Yes, sir. I think there's some network issue.
Unfortunately, some network problem is there. Can you hear me?
Yes, sir.
Yes, yes. What is your opinion or suggestions on that?
I used to give my example, like I also have bucky teeth. My two prominent teeth are quite prominent than other one. I have two dimples which are from syphilis. So I used to give example of myself and
Yes, that's good.
just explain medicine from your side. I also want to hear it.
Yes, especially when you are a teacher in a professional in a homeopathy medical college, should have the capability to explain such way. Because you can stand in front of the students as a typical example. So they will learn with ease. If anybody would like to participate, please raise your hand. Then what? Yes, let me know who is that. You can unmute now, please. It is always better to enter the program with your name. Let me note 6 Pro.
Yes, sir. Good evening, sir.
Yes, please. Please proceed, doctor. Please. Please unmute. Yes, doctor.
My
Please, you
name is
can. Yes,
Yes, sir. My name is Neha Parveen, sir. I
yes,
am from
please.
Dr. RBS College, Gaya.
Good. Yes, welcome. Please, doctor. Proceed.
So
Yes,
now
doctor.
I am in second year. Second year.
Yes, good. Very good. Please proceed.
Sec-
Do you have any question?
no, ma'am. No question. We are
Okay.
liking, ma'am, your meeting, ma'am.
Okay. Thank you.
Yes, ma'am.
Yes.
Ma'am, please continue.
Yes, yes, no problem. Welcome. It's very, very interesting. Junior students are participating, and at the same time, it's the reading is the most important thing, and we must study selfly. That is the most important, especially with homeopathic philosophy, because the physician always needs some bent on philosophy. Then only you can explain this homeopathy principle. They can understand the difference between this vital force and the vital principle. Only a philosopher can explain. It's like that. And as initially I said about this, the presence of this miasm and the aphorism hunt, I think, anyone explains everything is needed. What is the difference? A more comprehensive case taking is needed in case of this Crohn disease.
Yes, sir.
Because the relation between these symptoms, whether it is dependable or needed, is one can follow only. Dr. Gurukiran, are you there? Doctor, he's not there. He's an expert young physician. Often we met in this IFPH platform, but unfortunately he's not. Anybody would like to? May I invite Dr. Paul Joseph? Dr. Paul Joseph, are you there? Everybody is busy with the Christmas schedule. That may be the reason. Dr. Paul Joseph, who is often present in the IFPH. Dr. Are you there?
No, I am on driving.
Yes, Dr. Please.
No, I am on driving.
Okay, okay.
I'm on drive. Yeah,
So it's very
I'm on driving.
important
I
to
drive
have
the car.
your attention full on not on this session, but on the road for the safety of yourself and others. Yes, thank you, Dr. Paul Joseph, for responding. Dr. Vaidehi, what about your medical college and what is the atmosphere and how your students are, and what is your expectation from your students, especially on this miasmatic aspects, studying this miasm? Yes, please.
So actually, I'm teacher of practice of medicine. So I'm mainly focused on that subject, not on miasm. But yes, I used to consider because all the pathology, when we explain the pathology, there will be miasm, and they are quite good at that.
Sorry, the network problem. I couldn't hear you. Please.
So I
Dr.
said,
Vaidehi, yes, please repeat.
I used to teach practice of medicine. So while during explaining all the pathogenesis, the pathology, I used to tell them the miasm, and they are quite good at that.
Yes. What about the IPOP facilities or hospitals? That is also very important. Police hospital, how it proceeds.
Everything is just fine, sir.
because it's a totally practical science homeopathy, but unfortunately we are not able to capitalize on that. Is the main problem. Because day-to-day life programs, health problems faced by each and everybody, either acute or chronic. The other side, there is no treatment, but unfortunately, we are not able to capitalize on that. That's the most important situation. Dr. Tanesh, yes, please.
Yes, good evening, Dr. Vaidehi. Good evening, Dr. Manoj and members. It's really a very good session from you. And usually the most important aspect of homeopathy lies in the foundations and the theories of homeopathy and the pillars of homeopathy is really, these are the things that PSORA, syphilis, psychotic, all these three combined to form the top pillars for homeopathy. And if you are able to conquer these things, definitely you will be a winner at homeopathy. And you have shown how beautifully these typical phase of the PSORA. Usually people believe that PSORA is something itch, and itch is something, those symptoms arises due to these itching conditions are always PSORA. But you have shown in a different way that each and every remedy has a psoric phase, psychotic phase, and syphilitic phase. And the phase outlook itself will say whether the patient is in the psychotic phase or syphilitic phase or even in the psoric phase. So that you really able to demonstrate beautifully the picture of PSORA today. And those who really watch this session will definitely will be a winner at the psoric symptoms and psoric personalities, I must say. We can, of course, people used to say that no patient is fully psoric or syphilitic or psychotic. It is a combination of either one or two or sometimes or all these three. And in those conditions, how the facial changes will happen to a patient. Do you have any answer for that?
Yes, sir.
Usually, we have a patient with the psoric phase, but we used to say that every medicine has different stages. One in psoric stage, syphilitic stage, and psychotic stage. What's your opinion on that?
I don't know that much about it.
Because a patient sometimes in the beginning stage he may be in psoric level, but in the later stage sometimes he may change into psychotic level, and in the last stage he may become a syphilitic phase. So naturally the facial expression of the patient will be different. Am I right?
Yes, sir.
And this is what I mentioned, because even in sulfur, we used to say it's a psoric remedy, but it can go into a deeper level, and it can have these three phases. That's why if you have a patient with warts on his face, you can sometimes sulfur alone will cure the case. So that means that the patient is that's at the time of consultation is in a psychotic level. Am I right?
Yes, sir.
This is what I want to add to this point, presentation.
Yes. I think Hariharan sir is there. He is the most suitable person to comment on this. Dr. Hariharan sir, are you there?
Yes, sir is there, but
Yes, I think he's just joined and definitely.
Hello,
Yes,
hello.
yes,
No,
sir.
very sorry. Hello, Dr. Manoj.
Yes, sir.
Sir, doctor, I am very sorry because I not heard the class, because one of doctor, your friend has came here. See, one doctor from Trivandrum. You know, that is, he's your friend. One agricultural officer come here,
Yes.
doctor. You know him?
A wonderful personality, Dr. Nizam.
Nizam. He came he came my home at 5 o'clock and he departed about 8:30.
Yes. He's a wonderful personality. Just I think after Boniasan came from this agriculture field. Then this person also studied homeopathy after completing this agriculture course, and he was the gazette officer in the government of Kerala. At that time, he came to study the diploma course in homeopathy. Most remarkable personality, yes, sir. But the question is now, the Dr. Thanesh said about this, the changing phases of this medicine. At one stage it was psoric, then becomes psychotic, then becomes civility. That's also the question, Dr. Thanesh. Dr. Thanesh, am I right?
Yes,
Please
yes.
unmute. You can unmute, yeah.
Dr. Dhanesh said, see, first phase is maybe psoric, then it is go to the psychotic, and then it is going to syphilitic. Is it so, the Dr. Dhanesh?
Yes, exactly.
See, my opinion is that, see, if suppose a patient is coming to us and we are taking the case, and see, the most of our cases are mixed miasms, most of the cases. See, only predomination is only there. It may be psoric predominated, maybe it is psychotic predominated, or it is syphilitic predominated. But if the curing is taking place from reverse order, is reverse order, then syphilitic to psychotic, from psychotic to psoric stage, then curing is likewise in reverse order. So when a patient coming to us, after taking the case, we can understand which miasm is predominating. And we must find out the constitution and the predominating miasm. These two are very, very important. So sometimes it may be in a pathological stage. Say we must prescribe a pathological remedy also. This is my prescription. Different doctors are doing a different method. My prescription is first of all the finding the constitutions, and then find out the miasm, and any pathological remedy is needed, I will also do that. That is my prescription.
Anyway, the presentation, I think you can watch in the YouTube. It's very wonderful presentation, sir, because she described about the features, the facial features of the psoric miasm, the hairline, the forehead, eyes, nose, mouth, lips. The 12 features she explained. So with that, we can identify which is the miasm of the patient. That's quite interesting, sir. That was the topic today. But unfortunately, you just missed the live presentation, and you can see in this YouTube.
Okay, tomorrow I can see it and comment upon it.
Yes, yes,
I'll
he's
wait.
always regularly watching our programs and making our comments. And these old generation doctors, they are very brilliant in their work, and they're real model for the new generation physicians. Hardworking. Dr. Hariharan sir is one of them. Then Dr. Sridharakum sir, Dr. Madhavan, a lot of that is the most astonishing or important highlight of this platform IFPH. And if you regularly attend the program, you can understand what I mentioned. Dr. Tanesh.
Exactly. This is what
You are muted. Please unmute, Dr. Ganesh. Yeah.
our senior doctors are giving a lot of knowledge as well as their expertise with homeopathy in this forum, so that those who really utilizes are the benefiters, and definitely they will be winner at homeopathy. You people like junior doctors are also contributing a lot, because you people really go into the deeper layer, and you have the knowledge of technology as well as everything, so that you can Dr. Vaidehi and her team can definitely contribute a lot for homeopathy, but not only for the juniors but also for the senior doctors like us, because we people have no such knowledge in those technologies, And your presentation are really a great presentation, I must say. That really contribute not only for any the people attending this forum, but definitely homeopathy at large.
Yes, that's why Dr. Ken beautifully described. Things will grow brighter as minds are brought together and men think harmoniously. The more we keep together, the better. The more we keep on us, the better, best. Do you remember these lines from Dr. Kent, the homeopathy master of America? Dr. Kent often described this. Any comment, Dr. Vaidehi?
I have no idea.
Yes, that is the most thing. That is I just mentioned. Only those fellows having some sort of philosophical bent on the mind can really taste homeopathy, and they can transfer this energy.
Always, Dr. Manoj, a homeopath, a true homeopath must be a
Homeopathy system. And I think it's time to wind up the session. May I invite Dr. Thanesh to express sort of thanks. A single word on Thanesh.
Definitely. I'm very happy to have such people like Dr. Vaidehi and her team, because all these doctors can really contribute a lot of things for the future of homeopathy, because homeopathy is at the time of crisis, and we people can really work together to make it possible that homeopathy we now as present we are at the second largest system, and now we can try to bring up homeopathy to the world #1 system in the future. And thank you, Dr. Vaidehi Gupta, on behalf of International Forum for Promoting Homeopathy, as well as on my behalf. Thanking you once again. Okay, with that, we come to the end of the session, and it is the time to wind up the session. And now I am taking over for Malayalam session. Thank you all. I think Manoj Doctor has some problems. Yes.
Yes, that's. We all know that the network is always creating problems than the other things always, because we must wait for the 5G technology to arrive. Otherwise, it is very difficult. Often the network creating problems, and I think it's time to wind up the session. And on behalf of IFPH, I am wishing a happy Christmas to all the participants and around the world. The remark, let me conclude today's English edition. Hope we will meet tomorrow at the same time. Till then, goodbye. And Dr. Thanesh for the continuation of program in Malayalam. Thank you.